I will send it over to you in the kitchen.
Thanks, Brianna. Good morning, everybody. I am here with Dr. Riddock from Multi-Care Rockwood Health Clinics, and we're here to talk about metabolic syndrome, fats, and exercise. So, Dr. Riddock, what is metabolic syndrome, and how can we alter that with a little bit of exercise?
Yeah, no, I appreciate being here. Thank you very much.
You're welcome.
This is something I'm pretty passionate about. So metabolic syndrome is a constellation of risk factors that are kind of worse than the sum of its parts. And so as we are more sedentary and as we fail to burn off some of the fuel that we consume throughout the day with some of these eating choices that we have,
right.
We have seen an epidemic in obesity. We've seen an epidemic in metabolic syndrome. And so we might get a little excess belly fat. Our blood pressure might start to go up. We might see changes in our lipid profile and our cholesterol, high triglycerides, low HDL, and we might see the onset of diabetes or prediabetes. Now that leads to a specific pattern that unfortunately can cause premature heart disease.
And how does exercise, before we get to this visual here, which is really interesting, how does exercise sort of reverse this metabolic syndrome?
Well, you know, our bodies are really meant to move, and our heart is the primary organ that is supplying nutrients to our working body. And it's very important to keep that as efficient as possible. As we stop doing those things, then we actually start to see some structural changes in our heart that can lead to forms of heart failure. We call it fibrosis, which is like microscopic scar tissue in the muscle. And that can cause a problem. Now, as we exercise, we can alter that in a beneficial way. We can change our lipid profile. We can keep the heart functioning smoothly and efficiently.
Okay, so let's get to this lipid profile quickly for the sake of time.
Yes,
so we have about a minute. I want to get this in really quickly.
Yeah, so here's an example of kind of what, you know, if I send you to the lab for a cholesterol check, it's essentially, you know, LDL cholesterol. It's essentially as if we're, you know, grinding up these fruits in a blender and measuring the content of the juice inside of them. But that doesn't always tell us what the particle count is. And so the particle count is essentially the particles are trafficking cholesterol through our blood vessels.
Okay.
And, you know, cholesterol is a fatty substance. It needs something to traffic it through the blood vessel.
Okay.
And it's in the particles. So if I have two individuals here and they each have identical cholesterol numbers, they may have vastly different particle counts.
Great.
And so we may underestimate risk in those people with metabolic syndrome, with that excess body fat, with high blood pressure, with diabetes or prediabetes. And so it's very important that if you think that you might be at risk for something like that, that you have this discussion with your doctor.
Thank you so much. We're going to talk more about what these numbers mean, and especially when you're comparing them with each other. People like to share stories. So for the sake of time, we're going to talk more about this on Facebook Live, and we'll be back with more KREM2 news right after the break. Thank you so much, Dr. Riddock.